welcome you all participants of this open day of Shenzhen Open University. On behalf of me then, I may be your future teacher on Western medicine. I'm Tione Korthout, physician. I've got my own practice in Sleewijk, halfway Utrecht and Breda, as a physician for acupuncture, but specialized in ear acupuncture, auricular medicine. But besides, I'm also a senior teacher in Western medicine in Amsterdam, but also where I'm here right now in Arnhem, so at 2 schools. I just give you a presentation about some highlights, what can be expected. I share my screen. Share. And is my screen visible for you? If there are problems, Rob, you tell me, yeah? Like this would be best. So, I'm talking about Western medicine, something about the importance of Western medicine at Shenzhen Open University, some objectives of this part of your study, the study program and what we offer and what we expect, and something about teachers. Well, with this picture I show that first there is TCM, traditional Chinese medicine, herbal medicine, tuina, acupuncture and other techniques. And there is a stethoscope on the other hand as a metaphor for Western medicine. Western suggests that there is East and West, but Western medicine is merely like a natural science approach to health and to how body works, as a kind of contrary to Eastern manners of looking to person, to health. But of course, we just have to do with one patient, and we can look at different types with different from different perspectives to the patient. The so-called Western medicine, Western is from a Western perspective. If you are in Central Africa, maybe that's the center of the world, and then Western medicine might also be denominated as Northern or so. So it's just a matter of perspective. Anyway, this is Mr. Hippocrates. In ancient Greece, he is the father of the so-called Western medicine, Hippocratic medicine. Nowadays, very important, maybe the natural science medicine is also be denominated as evidence-based medicine, and evidence-based, so there is scientific proof for what we are doing. It's maybe a little bit like golden standard, no, definitely a golden standard, but also a little bit like Bible maybe. Evidence-based medicine, so research and publications and reviews and peer reviews and statistics and a lot of technical parts are involved in evidence-based medicine. Medicine is about curing people, and evidence is evidence, and what we do should be based on evidence. Western medicine, maybe it's a little bit like this as well. You start with molecules, no, atoms, and atoms clock together to molecules, and molecules build organelles, tiny little structures in the cell, and this all together builds a cell, and a lot of cells together build a tissue, and a lot of tissues together, 1, 2, 3 types of tissue, build an organ, a blood vessel, and all these organisms together build then the blood vessels together, first organ system of the blood vessels, and then this all together then finally with other organs builds a man, a person. On the other way, you can look at the patient, you can look at your partner or a child or father. You see a person, and you know that person consists of organ systems. In the organ systems there are parts, and of the parts there are tissues, and in the tissues there are cells, and in the cells are organelles, and the organelles are molecules, and the molecules are built of atoms. So it's a way of perspective from natural science. But on the other hand, you have to do with patients, with persons, and you do not consider so much all these detailed parts. So it's a matter of maybe cutting to pieces and then bringing them together. But the whole always is bigger. So in Western medicine, important is the interpersonal contact between the patient and the doctor, but also physical examination plays a part. And maybe laboratory tests play a role, blood sampling, urine as well, and there is microbiology taking part of having a part, and diagnostic techniques like X-ray pictures and CT scans and so on. So imaging techniques play a role, and in therapy, surgery may play a role, and so if surgeons take away pieces of tissue, then they are tested under a microscope. And then histology may be part, or cytology when you examine cells. And for therapy, drugs may even be involved, chemical structures or physical measurements like radiation therapy to tumors also. This all are just some aspects of Western medicine. And as a student, you should know all about these things, at least to some extent. Evidence-based medicine, it has a very complicated explanation. I was looking for a different word. Definition. I'm not going to read this. It's not so much of important. But evidence, everyone's talking about evidence. This morning I heard on the radio that there were 2 reports that there was no evidence that hydrochloroquine is effective against COVID-19 infection, or that it should be a good drug or so. And then also they said, yes, okay, the one report in the Lancet said there was no evidence, but then others said, well, there were a lot of mancos on the report. Anyway, there are all kinds of evidence. If you test something in a test tube and you see something happen, that's real, but it doesn't tell much about a group of patients. And if some people have opinions, editorials, and articles about bright ideas, they do not apply on the entire population. Case reports are interesting. A very nice case in this patient. I cured this patient in this way. So it's very interesting, but it doesn't mean that all the same type of patients will react in the same way. So better is not one case report, but a series of cases. And a series of cases have more importance than just a single. And case control studies, so if he did this and that was the outcome. Now, if we first, to a group of patients, we say we do this intervention and to 100 persons, and then we look in the end what the outcome will be. Then you have case control studies. And then there are cohort studies in bigger groups. And nearly top of the bill is a randomized controlled double-blind study. So first we have group A and B. They must be exactly the same, but one thing is varying. And if one group gets the variety, another one gets not, and they do not know whether they have it. And then later on we will see in the outcome whether there are differences. And if there's difference between both groups, then it must be due to this one item which was varying between both groups. And top of the bill of evidence is systematic reviews. Then you take a bunch of RCTs, and then you study for the quality of it. And if a lot of RCTs have the same conclusion, well, then it's very strong evidence. This is all about evidence. But evidence-based medicine, according to Sackett in 1996, and he was the inventor of what evidence-based medicine is. Evidence-based medicine, it is the mix of relevant scientific evidence, but nowadays there's so much emphasis on there must be evidence, 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 but this also must have interference with the clinical judgment of the therapist or the doctor. And likewise important is the patient's values and preferences. And where these three meet together, this is evidence-based medicine. Don't forget that what you do with your patient is a kind of a black box, but also has its effects. So when people talk about evidence-based medicine, mostly they just refer to this. And it's far too little. There is far more an experienced doctor, like hydrochloroquine, which is an anti-malaria drug. If you give it to COVID patients, then it should be a problem. No, it should be given to rheumatoid arthritis patients. Hello, it was proven effective for malaria, but the clinical judgment is that doctors found out that it's also very important in treatment of rheumatoid arthritis. And if the patients are fond of it, okay, then it's okay. Evidence is just there. Whoa, we see 4 dogs. We see 4 dogs, all with different glasses. Oh, now other students come in. It's not what I mean. But the glasses you wear determine the contrasts you see in the image. And Western medicine, it is a view with a kind of glasses, but Ayurvedic medicine has slightly different aspects, and acupuncture and traditional Chinese medicine also look with different glasses. The subject is always the same, but the contrasts are determined by what you see. I've got a nice story, which I'm not going to tell you right here now, the teapot story, but you can imagine if you look with yellow glasses to this pot, you see a very blue pot with some white spots. But if you look through blue glasses, you see a grayish pot with very bright yellow spots. So depending the glasses you wear determines the contrast you see. And Western medicine and TCM are just different glasses, but the teapot is still the same. So we try to make some relation and to show the overlap between different systems. So integration of alternative medicine also requires reciprocal understanding. You must understand what the doctor means if he tells something, and preferably the doctor should also understand what you talk about if you talk about Tuina techniques or TCM relations. You must be able to perform interdisciplinary communication. You will have the opportunity in the course by playing with that. Very important of the course of Western medicine on Shenzhou is patient safety. Attention for red flags. If you see a patient with a certain symptom which is dangerous for the patient, for society, whatsoever, you should determine this. Wow, this is a red flag, and then at least the physician, maybe medical specialist, should be consulted. Patients should be referred to them. So you should also be able to recognize when referral of your patient to the so-called Western medicine system is required. You must also be able to interpretation of Western patient data. It can be that a patient comes to you with, hey, here I've got a letter from my GP to the medical specialist. You can read it and then you see it. It's good if you can understand what they're talking about. So medical terminology, for instance, is also part of the study. And you will be touching a little bit on medical publications, on evidence of effectivity of treatments or so. The objectives of the course is fundamental knowledge of anatomy. What does the body look like? Physiology, how does the body function? And pathology, what look diseases like? And also medical psychology. There's a separate teacher for that, a qualified teacher. I'm the teacher for anatomy, physiology, and pathology. You will also gain some basic clinical skills, physical examination, some laboratory testing will be there as well, a part of the course. You will also get in touch with pharmacology, at least some basic knowledge about that. Healthcare law in the Netherlands, because the course will be certificated by SNRO, which is a certificate to be good qualified therapist in the Dutch healthcare system. So you must know something about healthcare law. Medical ethics and you will get in touch with some scientific data and articles. You will have to fulfill demands of insurance companies, but if you fulfill this course, you fulfill to the demands, then you get your accredited certificate. It's an intense one-year course about anatomy, what does the body look like, and physiology, how does it function, and pathology about diseases, diagnostic processes and treatment, and medical psychology. Examination, there will be 2 multiple choice exams, one in the first day in the new year, so in January, and the second one in the end of June or in July or so. There will be oral presentations during the class, so you will have to prepare your presentation and give the presentation to the class. You will have some portfolio tasks to do. You also gain study points, study hours by doing these tasks, so it's also part of the study. What does the school offer you? One course weekend per month, that's to say Friday and Saturday. It's a diverse and interactive learning program. You see how enthusiastic the students may be and how hard there is worked. There are professionals teaching from their practical experience, so it's not just theoretical blah blah, but also from their experience, which makes it very attractive, I think. You will acquire theoretical and practical skills, and in the end, if you did all well, you get a SNRO accredited certificate, and this certificate is important if you want to get member of some therapist association later on. Meanwhile, you have interesting contacts with students of various nationalities and various backgrounds, which is also a challenging item, in a positive way, of course. We expect high motivation because it's hard work. It's definitely tough work, so you must be motivated. You must do active preparation and participation, because I'm a teacher and I'm not giving classes, I provide education. So you study in advance and then you come back to class and then we talk about what you have studied. So you cannot just come to class and say, I hear is blah blah, and then I know everything. No, you definitely have to study, which is fun, of course. There must be at least 80% attendance to the class to be sure that you have your teacher contact. Open-mindedness is important. Okay, it was my pleasure.
Yeah.
All success with the other presentations, and please, if you have questions, ask the questions, because we are glad to answer them. And I hope that we might meet one or more, or a lot of you guys next school year in Amsterdam. So, goodbye. I log out now, so I continue with my classes here.